Mr. Davis of Kentucky.
Thank you, Mr. Chairman. I'd like to follow on what Mr. Teaberry says, since our districts are relatively close to each other, and I strongly disagree with the gentlewoman from California on her statement. I think it was filled with generalities, and based on my personal experience with my own mother as a member of the United States Congress, navigating through the Medicare system and, frankly, an Anthem Blue Cross supplemental plan that supposedly would give this coverage, I watched the future of American health care in South Florida, which effectively becomes a meat market for the processing of senior citizens. The problem that you have with the liability component is the SGR is process-driven. In the last 10 months of my mother's life, against the wishes of the family because of decrepit competence laws in the state, she was put through 4 procedures. She was dying at the time of cancer, COPD, hypertension, and diabetes. The procedures that were done, the only reimbursable procedures that the doctors had, and plus because of the way the SGR was structured, all of the physicians taking the case were under extraordinarily high liability if they did anything to deviate outside of that. There were no provisions, as I've worked with the gentleman from Oregon on end-of-life issues with slow medicine. There were no provisions whatsoever within the Medicare framework to do anything else. Over $500,000 of fruitless procedures were done, not only reducing her quality of life and largely against her will in a state of marginal competence. The fact of the matter was she suffered so people could be compensated. Costs were driven up on other people and the taxpayers. I witnessed this from the inside and felt the anger and the hopelessness that many people have. To say that liability is not a component, that defensive medicine drives decisions of physicians on dealing with inevitabilities is simply either false or ignorant.
Will the gentleman
yield? No, the gentleman will not yield. The gentleman has heard a lot of generalities for months. And my mother was a nurse. I worked in a hospital. I have a daughter that's working in a hospital now that confronts this every day as a future nurse, who's actually been told by 5 different physicians not to become a doctor because of the incredible cost. She's been told to be a nurse practitioner. She's been told to be a PA. But you'll save the debt and you'll save the liability cost by going into some other form of medicine. Indeed, I'll take that one step farther.
Aware that Ohio already has a cap in place, and that doesn't seem to have
not in Kentucky. We lost 1/3 of our OBGYNs in private practice due to the excessive liability premiums and fees in the state. The only ones in the eastern half of my district that came back in the last 3 years were, in fact, employees of hospitals and not independent practice people. We have to take into consideration these facts. If you want to change this system, and I agree with my colleagues on the other side of the aisle, I want to reform our healthcare system. It desperately needs it. But there's 3 things that have not been addressed in this bill, despite the incredible work that so many people have put in, and I think well-intended. Even though I disagree with many of the policy pieces, I appreciate and respect the tremendous effort. You've got to re-engineer the way Medicare works that drives costs. You've got to, from there, go out and really bring true insurance reform instead of legislating it out of business, which is effectively what it does. And finally, without meaningful liability reform, because we're talking about a competitive or comparative effectiveness board that's going to determine what acceptable treatments are, what do you think doctors are going to do? They will only function within that framework to avoid liability. To say it's anything but that is a mistake. We've got to pull it in to save costs, to help people with quality of lives, and allow this overall intent that I think we all have to work, and I yield back.